It was approximately 2 years ago now. I wasn't feeling great. I was feeling really unwell and I was really feeling nausea. I was just not feeling myself and I didn't know what it was. I kept telling myself, I'll be fine, just get over it. The main symptom was fatigue, feeling unwell. So I went off to my GP and I told him of all the symptoms and he suggested that I be referred to a cardiologist, and then the results come back that I had cardiomyopathy. It was a shock because you just think, it can't happen to me.
The early symptoms of heart failure are often fatigue and breathlessness, and often people feel they're just getting older and this is life. Sometimes as the symptoms progress, you get swollen ankles, you may feel short of breath if you're laying flat in bed, or wake up gasping for breath because you've got fluid on the lung. You may get abdominal distension and bloating and nausea because your belly's full of fluid. So they're more advanced symptoms, but often people tend to put up with them and think that's just part of getting older. The risk factors that make people susceptible to heart failure are age, which we can't modify, having coronary artery disease or having heart attacks in the past, high blood pressure, diabetes, atrial fibrillation, which is an irregular heartbeat, sleep apnea, obesity. So all of the diseases that we are commonly seeing as people get older are risk factors for heart failure. There are patients who have heart failure which is what we call familial, which means it's inherited and runs in the family. They're often younger patients who may have very healthy lifestyles and they've done nothing wrong, but they've inherited the genes that give them heart failure from their parents.
I've made sure that my boys go and get tested on a regular basis, every 12 months to 2 years. I try and encourage them to live a healthy lifestyle. That's important, but because it runs really strongly throughout our family history, they do have a 50% chance. So I don't want my children to get that. So I encourage them to do all the right things and go and get tested.
Heart failure is not uncommon and can cause serious illness if it's not picked up and treated early. So if you have breathlessness, if you have nausea and abdominal swelling, swollen ankles, and in particular just fatigue for no apparent reason, this could indicate heart failure. So I'd really encourage you to see your GP, to get checked out, to make sure that you're not developing heart failure, because if it's detected early and treated well, we can often stop it progressing to more severe disease over time.